Hi, I'm Dr. Nancy Duncan from Duncan Hearing Healthcare. Welcome back to Nancy Knows Hearing. A question I hear all the time is this just normal aging or is something actually wrong with my hearing? Well, people often put this off for years because they don't want to overreact or they assume struggling to hear is just part of getting older. So today I want to help you understand the difference between normal aging changes and hearing loss and how do we know when it's time to get it checked. So first, let's talk about what normal aging can look like. As we get older, it's common to notice things like needing a little more time to process information, or feeling more tired in noisy environments or overwhelming environments, and occasionally missing a word here or there. These things are usually normal. They're mild, inconsistent, and don't significantly affect daily communication. If you can still follow conversations most of the time, even if things feel a little less sharp, that may fall within normal aging. Hearing loss tends to look different. Some common signs include frequently asking people to repeat themselves, hearing that people are mumbling rather than speaking clearly, trouble understanding speech in restaurants or groups, needing the TV or radio louder than others prefer, or you can feel exhausted after social situations. A big clue to this is you can hear sounds, but you don't always understand speech clarity. Almost telling people I hear, but I don't understand. That's not about volume, that's about clarity. And here's why this gets confusing. Hearing loss usually happens gradually, affects certain pitches first, allows you to get by for a long time, and your brain fills in the gaps until it just can't anymore. So many people say, I hear fine when it's quiet, or I'm okay one-on-one. It's just the background noise, that's the problem. Well, those are classic early signs of hearing loss, not just aging. And here are a few questions I often ask patients. Do you avoid noisy places because it's just too hard to follow conversation? Do you feel more tired after listening than you used to? And do others comment on your hearing more than you notice yourself? Do you rely on subtitles even when the volume is turned up? And if you answered yes to any of these, it's worth having your hearing checked. Let's take a look at it. This isn't about labels, it's about getting support and getting the help that you need. Untreated hearing loss can lead to increased listening effort, fatigue, frustration, social withdrawal. And when people assume it's just aging, they often delay care, and that can delay matters worse. It can just make things worse. Getting clarity early gives you more options and easier adjustment. A professional hearing evaluation can measure how well you hear different pitches, assess how clearly you understand speech, identify whether changes are within normal limits, or confirm hearing loss that can be helped. And no, getting tested doesn't mean you have to get hearing aids. It just means that you're getting information that you need to make a decision that's right for you. So if you're wondering whether your hearing struggles are normal, the question alone is worth paying attention to. Normal aging doesn't usually make communication feel stressful or exhausting. If listening feels harder than it used to, your hearing deserves a closer look. If this video helped, like it, subscribe to Nancy Knows Hearing, and share it with someone who might be saying it's probably just my age. Thanks for watching, and I'll see you next time.